for Success, where we break down how to build a high performing practice through data recovery and targeted therapies. That's how you drive outcomes, retention, and real growth. Let's dive into this. Today's topic is PEMF, or pulse electromagnetic frequency therapy. As we know, most practices out there are treating pain, but patients want more than that individual procedural treatment. They want actual recovery. So the real question then is, how do you create something that patients actually want to come back for week after week after week, creating that destination experience? Today, we're going to be breaking down PEMF, what it actually does at a cellular level, why it's becoming a core part of the modern recovery stack, and how practices are turning this into actual recurring revenue. Today, we're joined by Jeff Swearingen from ErgoFlex Technologies with the Soma Charge. Jeff, let's start this out real simple. First, welcome to Optimize for Success. Good to see you here.
I
Uh,
see you as well.
and we want to let's look at this from the most basic level. What exactly is PEMF?
So PEMF is pulse electrified magnetic field. It's a science and technology that's been out there for over 50 years, heavily researched in different categories. And one of the things that we look at for the PEMF is how can we utilize that in an office or a practice setting for folks that are looking for something that's non-invasive. And there's a broad stroke of how it relates to the cellular level and the actual signaling that happens between those cells to really have an impact across different avenues or channels, if you will, from inflammation, chronic pain, circulation, and then also recovery. In some cases, in some states, it shows some regeneration at some levels.
That's awesome. So, as we get into that, what does that overall experience look like? As somebody comes into the office, what are some of the, first steps that the patient can expect when they're getting the PEMF treatment?
Yeah, for treatment, the great thing about that, because it's not invasive, it's very easy to receive the treatment, but also easy for the staff in the office to implement when they're working with their patients, because it can be done in a very relaxed setting. So depending on if you're using an individual attachment for a specific joint or pain specific area, or if you're doing more of a systemic where you're in a more relaxed state, there's a mattress that will provide the PMF treatment where you're getting a lower level frequency and intensity, but again, very acute to what we're trying to accomplish. So it's a very easy thing to implement within the office because you can do it in any room in your office. You can do it in an open setting in your office as well, depending on how your office is set up.
That's awesome. And as far as what the patient wears, is there anything specific that they should know about before coming to the session, or just kind of come as you are?
Yeah, so pretty much it's come as you are. Some of the things you're going to want to think about when one, you're putting the patient either on the PMF mat or utilizing one of the specific attachments is you want to make sure a few things. We have a simple checklist that we utilize with our Soma charts that we provide to our clinics. That's kind of a checklist. You want to make sure, one, do they have any implants? Because the PEMF can have some effect if there's any electronics involved. So if you have a pacemaker, if you have an implanted stem, those are some things you want to make sure you're cautious of. The other would be is working with pregnant women. That would be someone you would not want to put on the PEMF. But pretty much aside from that, if you have expensive electronics, we always kind of laugh about watches and stuff like that. When people have a high-end watch, let's go ahead and take your watch off. We do recommend that you don't utilize your phone or your iPhone. Probably won't have a big effect unless you lay it directly on the PMF. But again, just to be safe and protect yourself as an office, I would have them not utilize the electronics while they're on the PMF.
It's a good idea. Probably don't want to bring electronics and electricity and magnetic in the, in the
Yeah,
same area.
and one thing that we also see too, Jeff, is we also ask if they have any kind of surgeries or implants where they may have screws or a rod,
Okay.
something metal within their body. It's okay if they do have that. Just let them know that, especially if you're working on a specific area like a shoulder, and let's say they have some screws or something in the shoulder, they may feel a warming sensation, but again, it's not going to be anything that's going to affect the treatment.
Okay. That's great. And then from a clinical perspective, what are you seeing mostly right now within the clinic space, more towards pain, speed of healing, inflammation? Like what are some of the key uses of the PMF technologies?
Sure. Again, because it does have a good impact across a broad stroke, if you will, depending on what the goals are and what type of office setting you're working in, whether it's a chiropractic, if it's a medical office, or if it's PT, et cetera, you're going to see a range. But what we see the most is going to be an inflammation, circulation, and then recovery. And again, if you're in a sports setting, obviously recovery is going to be important because those folks that are working out, you can have a better recovery because you're going to get that circulation back to the areas that you're working. But that also transfers into the medical setting where if you've had a surgery or whatnot and you're coming in, you can also see some recovery there, but also a reduction in inflammation, which is going to help out with that pain setting.
That, that's really interesting. So we can really approach it to work with recovery from more of an acute injury to chronic condition. Is that accurate?
That'd be accurate. Yes, sir.
And typically, I know I've heard from some people that complain of a hip issue they've been suffering with for a long time, have one session and then kind of resolution that the pain goes away. What is the typical um, workflow, quote unquote, protocol or a technique that most clinics are using? Is it kind of one-off sessions, or is it a bundle of sessions? Like, what does a typical treatment protocol look like over time?
Sure, that's a great point you say because, like, everyone wants instantaneous relief, thinking, hey, it's a one and done. But we try to talk to it more about, thinking about working out. And you go work out, you feel great the first time, right? You're like, hey, I really feel good. But did you really get the results that you're looking for over the long term? So we do look at bundling to where we're going to have multiple sessions. And we do recommend in sets of 12, so 12, 24, 36, that you can incorporate. And again, that's an opportunity to bundle and work with the existing packages you have within your office or practice to put that in play, because you will have some folks that after that first session, they're like, wow, that feels awesome. I can feel some relief. But in a couple of days, they're going to go, oh, my pain's back. So you want to set them up in a more traditional setting where it's, a pragmatic or setup of an extension of thinking about it as a workout session. How many times you work out a week? 2 to 3 times a week. You put that into practice, you can do that.
Okay. So if someone's busy, they get in once a week, they can do once a week, but you want a good expectation, good outcome, 2, 3 times a week. Do you reach a point where it might be too much if you had it available to you every single day? Is it something you come in every day for it, or is it more if it's more chronic, or how would you implement it?
Sure. In a traditional setting, 2 to 3 times a week is a good setting. One, that's a fair expectation for the people that you're working with
Yeah.
to come in 2 to 3 times a week, especially if they're in some severe pain or they're working for a faster recovery. They're going to get that result much quicker and
Okay.
start to see the long-term effects of what that PMF is helping them with. But
Yeah.
then we can also result that into a maintenance opportunity as well, where if they're coming in for different things over a long time, you can bring them in.
Okay. That's really amazing. Yeah. Yeah, I love that. I like, things, modalities, where it becomes and positions a practice to be more of a destination versus just very procedural based. So we look at kind of the pain space. Most people are used to going in, they see the doctor, the medical provider, and they say,
Mhm.
okay, I'm going to put you on this pharmaceutical. In this environment, it creates more of a destination. Are there any, if we're looking at like with shockwave therapy as an example, if someone
Mhm.
had a steroid injection, that's like the big no-no, that someone comes from traditional medical environment, they get a steroid injection, they have to wait 6 weeks until they actually get a shockwave therapy treatment. What does that look like with a PMF? Can it be incorporated into if someone had a steroid injection? You typically in this space trying to avoid steroids and surgery as much as possible and guide towards a um, uh, more energy-based therapeutic recovery response with shockwave and PMF and maybe red light. But
Mhm.
are there any concerns from that perspective, like with shockwave, where someone's coming from traditional medicine, medication, or a pain injection, where they have to wait before they have a PMF?
Yeah, that's a great question, Jeff. And focusing first just on, I guess I'll say, quote unquote, general medication. So that is one thing you do want to check, and that's part of that checklist that I mentioned earlier, is if someone is on blood thinners, if they have heart medication, et cetera, you want to be very cognizant of that, because the PMF, when you're on there, because of the circulation that it helps create, it can actually increase the bioavailability, I guess would be the term, but excuse me, the metabolism of that product that they may be taking. So I guess the same would be true if we're looking at steroids, where if you're taking a level of steroid, it could increase the metabolism rate of what that injection or that medication you may have just taken. So that's something you want to be aware of.
So they better off avoiding it or having them discontinue for a period of time before the treatment, or is there a way to really monitor if they are on the med and they're getting the treatment? What would we be looking for?
So I think if one thing you'd be looking for is is it a daily medication, or is it something where they get an injection once a week or once a month, as an example? If that's the case, wait a week. If it's like a once a week, once a month injection, give them a week's time to let that medication process and kind of get into its process before you put them on the PMF.
Okay.
If it's a daily medication or something they're taking like a blood thinner, I would definitely either one, if you're not the physician, consult with their physician to see what that might look like for that particular patient.
That's great. Real good advice. Real good advice. Now, let's kind of look at maybe on the research side, the clinical efficacy, a little bit of the science behind PMF, but there's still, I would say, within the traditional medical space, it's heavily insurance based. They look at energy-based therapy, whether it's PMF or Shockwave, or others, with a little bit of skepticism. Maybe that's
Mhm.
not, maybe that's
Sure.
too strong of a word. What is really separating PMF from some of that noise that's out there, to provide a little clarity on the technology?
Sure. I think the difference is going to be is one, it is true science, because again, the amount of studies that have been conducted for PEMF and how it relates to very simple blood flow to reduction in inflammation, impacting on certain disease states, which would be a whole nother call that we could talk about in what some of the science is showing there. But really, it comes back to the big difference of the operating insight component of how it relates to cellular health. And that is without a doubt been proven how PMF can result and show impacts on cellular health, and how one, the cells communicate and that firing signal, the electronics triggering between the cellular level, and how you actually see increase in ATP production, but also an impact on nitric oxide, which is going to help with that vascular component and circulation within the body.
Okay. So better oxygen delivery.
Correct. And so when you look at that and talking about, I think if we haven't touched on, I know it's something we definitely will, is how you can compact that or do that with adjunct therapies or other treatments or modalities, and how you can stack those.
Okay, I love that. Within, so just a little bit more on this. Are there peer-reviewed studies on PMF? Are there, and how long has the technology been around overall?
Technology overall has been around for about 65 years, from what we've seen in our research here. As far as the amount of studies that are out there, if you Google PMF and you look on PubMed and et cetera, some of these others, you'll find a plethora of knowledge out there, and probably more reading than you're looking for.
Okay, that's awesome. That's really good to know. Now, from a clinical perspective, those that are implementing, where are you seeing some of the biggest clinical wins? Is it chronic pain, post surgical surgery, maybe post surgical recovery? Is it inflammation, which we talked about a little bit, neuropathy? Is it and we talked a little bit about sports, but where is the biggest clinical win at this point?
Biggest clinical win that we're seeing in the feedback is going to be within chronic pain.
Okay.
And then secondarily will be inflammation, and then recovery. And then you mentioned neuropathy, which again, we haven't talked about yet, but that's one that we were surprised at, I guess, in our research and getting into this part of the field, is the impact it can have there. And so with those other attachments we were talking about that come with, depending on which system you're utilizing, you can definitely have an impact and expand your patient base as well, depending on what your setting is.
Okay. That's great. Now you touched on a little bit, and I've mentioned it, stacking modalities, working as an adjunct therapy. with what are some of the other modalities that you've seen PMF working in conjunction with?
Sure. Some of the ones that we see and we hear from our doctors and folks that we're working with can range anywhere from if you're utilizing any kind of laser treatment, such as a shockwave, soft wave, if you're utilizing physical adjustments. So we see groups that are working with us in the chiropractic space where they're actually doing manual adjustments, but they're also utilizing the PMF or the circulation in those areas or using specific attachments for a shoulder and knee, et cetera, that they're trying to work with to help expedite the results they're trying to get for that particular patient or client. And then one of the other opportunities that we see is oxygen treatment, and specifically working with IHHT, which is intermittent hypoxic hyperoxic therapy, which is a great combination because they both work on the cellular level. So there's a great combination in what you can see within the practice. And there's probably some I missed, but definitely wanted to learn more about how they can be stacked.
That's great. And we'll have another session where we'll sit down and we'll talk about the Mido 2 device that you guys have, which I think is really interesting, and to work in conjunction with what we're talking about today with the PMF. And I'm really excited about where PMF fits into our stack in terms of how we work with our customers all over the U.S. and our approach, looking at the different pillars of success for a destination practice.
Sure.
We look at metabolic, which helps to establish the baseline where our practices are incorporating DEXA and RMR VO2 max, and then the focus on recovery. PMF definitely fits into that stack with hyperbaric and red light, which falls into therapeutic, which is our third pillar with shockwave therapy. And I'm also really interested in, and I'm seeing implementation stacking PMF, shockwave therapy, and red light therapy in sessions. And I'm getting more and more feedback from the field in terms of which order those should be stacked in. And some are saying, let's do PMF first to prepare the site, treat with the shockwave therapy, and then post-treatment, have them lie and relax on the red light therapy table. And some are saying, put the red light first, then PMF, then shockwave, and then maybe another red light session, or maybe follow up with a PMF session after shockwave. What do you have any thoughts on that? Or is that more like the more focused on the provider themselves trying to figure out what they're doing?
Yeah, I mean, we hear a good combination, exactly what you mentioned as far as kind of which comes first, what's best. We hear some doctors will say, just like you, PMF first, followed by shockwave, followed by red light, and then maybe another PMF. Depending on your office setting, what your goals are, again, the time that maybe your patients will allow you to be working with them is another opportunity as well, because you can actually stack and do, depending on what type of red light you're utilizing, if it's handheld or if it's stationary with an adjustable arm, you could actually do that at the same time on specific areas that you're working actually with the PMF because it's not attached to the PMF. So there's some compounding there, but obviously with correct, yeah, you can actually stack them together. So there's some efficiencies that you can find in the practice because of what how and what you're working with. So I can't give you a hard and true like this is the best, because I've heard good results from physicians and folks out there in the field that will do that. And I think one of the most common I do hear is that they'll start specific on PMF on a specific joint. If they have some chronic or acute pain, they're trying to fix a hip or a shoulder, et cetera, and they'll use those attachments. Then they'll do shockwave red light, and then they'll put them on the mat on the PMF for a more relaxed systemic session at the very end to kind of pull everything together, and they'll break those two up. So that's one of the ones we hear the most.
Oh, that's great. That's good info. And then from a timing perspective, you brought that up. What's a typical session? Is it 10 minutes, 20 minutes, more than that? What would a typical session look like?
Sure. What we see the most in some of these suggested protocols that we also supply with our unit as well is going to be anywhere from 20 to 30 minutes is very typical. You can do a little bit shorter, but where we see the best results and what we hear from the folks we're working with, that 20 to 30 minutes is very acceptable by the patient, but also by the office setting for their flow.
Okay. Now, I've experienced PMF, been on different different systems out there. Sensation a little bit different, but what should somebody feel? Is it comfortable? Is it painful? Is it like what's that experience supposed to feel like?
Sure. Again, depending on which unit you may have been on prior or existing, our soma charge is considered a high frequency in what we utilize. Some people think, oh, that's going to be too much. Because the way, whether it's a electronic system or if it's a digital system versus a spark system, there's going to be a difference in how you can adjust the intensities and the frequencies within that piece of equipment.
Okay.
But the overall feeling you should feel is you should feel the pulsing, something you can feel, but it's not a pain, it's not a shock, if you will, in comparison, because some people will try to combine it and say, well, same thing as STEM. And we're definitely not the same thing as STEM when you're working with PMF. STEM is that needling feeling, that electrical kind of shock, and they're like, ooh, that's uncomfortable.
Yeah.
When you turn up a pulse on a PMF and you increase that frequency or you increase the intensity, you feel it more as and I'll use a simple term for lack of a better phrase, as a thud, right? It's a tapping like this.
Okay.
So there's an intensity level, but it's not uncomfortable. And the other thing we like to also share with is in looking at the science in PMF, it's more is not necessarily better, meaning you don't have to sit there and feel the most intense pulse to get the best effect. You want it to be comfortable, but you want to be able to feel it. And that's one of the things too, depending on if you're working with a unit you can feel versus some of the units that are out there where people's like, well, I don't feel anything. People want to feel it, as we all know. They want to, that's a mental capacity, so they know they're getting something, right? So with our soma charge, you do feel it, but again, because it's digital, you can adjust that frequency and intensity to match the outcome you're looking for.
Okay. So far from the conversation, it really sounds like the PMF fits nicely into a stack with multi-modalities. PMF is also an anchor for recovery, which is really important. And working with other modalities, the goal is if we're going to have PMF as that anchor for recovery, looking at great outcomes, patient, as you had mentioned, on a table or on a treatment 20 to 30 minutes. Now let's focus on the complexity of implementation. Sounds like if the patient's just lying there, sitting there, the medical provider doesn't have to be with them all the time. So a couple questions. Uh, are they able to set and walk away? And then who in the office is able to set the patient up? Are there any limitations on who can actually use it from an operator perspective?
Great questions. And the easy answer is anyone in the office can set someone up with the PEMF.
Okay.
Now, depending on if they're setting them on the mat, whether it's on a lounger or a table, that's the easiest. If they're working on a specific joint location, they may need to have direction or maybe within the notes for the file for that patient, what settings that doctor has prescribed, if you will, for that patient to receive. And then a nursing assistant can easily work with that, or even a staff member. We have doctors that have folks that are front end because they got maybe one or two people in the office. One's a person that works at the front desk but kind of does everything. Then they maybe have an assistant. You can utilize your full staff. The second part of that question was, do you have to monitor that person the entire time? The answer is no. Once you set them up and you either put that piece in the specific area, whether it's an attachment or if it's on the mattress, very easily can walk away, go take care of something else within the office, and then return. And we have some offices that will set a timer so they can hear it. So they know that patient's particularly done. If not, depending on the setting, they can do a pass by. So,
does it have an auto time off? So you set them for 20 minutes, and after 20 they're done. Is that?
So you can set the time so the equipment will shut off at that time. So the patient will for sure know, and then you'll know as well because you can hear it, and it's not something that's going to distract from what's going on around that person that's on the PEMF, but you can hear it in operation. So you will hear that audio as well.
That's great. So it sounds like there's a real scalable system, super easy to add into the practice. Workflow won't take any specific specialty, licensing, credentialing, certificate to operate it, to implement it. Also sounds like setting it up, You can have somebody up and running within seconds, set and walk away when they come in. That's all accurate then?
Yeah, it's all very accurate. The implementation, as far as bringing that into any office setting, will be pretty seamless. The people in the office can be trained relatively quickly. There's
Okay.
also some different certifications depending on how far you want that office staff to go, that either one we can provide or there's others out there
Oh,
that
wow.
are accessible. So you can actually get certified in PEMF and understand the science and how to utilize it at a little bit deeper level. Um, as far as the time it takes to set up, you're exactly right. We're talking 30 seconds or less. With the exception, if you're going from one attachment to the other, it might add another 15, 20 seconds because you have to detach and then hook up that extra piece.
Yeah. Let's go back to the certification. What does that look like? What kind of time would be required to help somebody become certified in PMF?
Sure. As far as to get certified within PMF and the certification that we've utilized internally, depending on your study habit and how fast you read and comprehend, you're looking at anywhere from 3 to 5 days.
Okay.
And that's breaking that up into like 2 hour sessions where maybe you're doing it on a break or after work. It's not as, if you sat down and did it on an 8 hour day, you could complete it in a couple of days.
Okay. So could it, and at our training center, we offer hands-on workshops. We do different types of workshops on a regular basis. Would that type of certification uh, be done in person, or is it done solo? And could it be done in person?
It could be done in person. We could definitely put it into a classroom setting,
Okay.
depending on the setup of the class itself. But it can also be done on your own on a home study,
Oh, wow.
where you actually log in with a code that will work you through. It keeps track of your progress, and at the end of it, you take a finalized test that makes sure you're comprehending the information, and you actually do receive a certification that you can actually hang on the wall if you want to put it up that says you're certified.
That's great. And can anybody qualify to get that certification? So anyone in the office that's using the device can be certified.
That is correct. If anyone that wants to take it and show that they can comprehend the knowledge base will get that certification.
Okay, that's great. That's awesome. I like that. Let's move a little bit into the business side of
Sure.
implementing, because I'm sure the listeners are going to be really excited about hearing that part of it. And as we start working with many practices, one of the areas that they come to us for is building consistent revenue. Again, moving from that procedural mentality, working on bundling, working on memberships. When we're operating within the cash-based medicine space, building not just consistent revenue is important, but making sure that we also have patient retention, patient re-engagement is really important to the lifespan of a practice. And so within this narrative, we want to look at how PMF impacts this. Now, are you seeing, and we can talk maybe what you're seeing as average one-off set, or maybe they're not doing one-offs, but let's talk about like one-off sessions, bundled sessions, and how many are you seeing around the country that they're putting in a bundle? What's the average costs for bundles? And then are they also building out memberships? Maybe they're charging monthly if it's an ongoing, because we're thinking about recovery. I work out all the time. I want to come and get my PMF, and I just want to have a membership where I come in, once, twice, 3 times a week to do my 20-minute session. What are you seeing the most of? Membership model, one-off sessions, bundled sessions. What's the most typical scenario, or maybe there's no typical? What are
Yeah.
you seeing out there?
Yeah, so there's a good mix, and again, depending on what the setting is. So if it's more of a clinical setting in an office or a medical facility, we're seeing more of a package setup, meaning that they're going to purchase a certain number of treatments or sessions that are going to go along with the other modalities that are helping with that particular person. So depending on what that looks like, if you're an office that, hey, we're going to do, we'll use Shockwave, which I know has been kind of the topic today.
Yeah.
Comparison or in conjunction with, if you're doing 10 sessions, 10 treatments with the Shockwave, you're going to match that with your PMF.
Okay.
And you're going to include that into that package. Now, as far as the pricing, it's going to depend on geographic and demographic and what the expectation would be. But we're seeing anywhere from $55 up to $110 per session
per session.
for that. Now, do you incorporate that full price into the package? Depending on how your business model is, you may give a discount because they're buying a 12-pack versus a 24, where that per time goes down a little bit to make it a little bit more palatable for the people that you're working with. So we do see that, but 12 and 24 are the two ranges that we see the most as far as the packages are sold. There's some that will go out to 36, but again, that almost transitions into more of a membership model now, because now you have someone coming back over a longer period of time.
Yeah, and you're almost better putting together monthly and just say you can come in twice a week and you're paying your monthly membership, and maybe instead of paying for the pack, and we can really work to help build some of those models out. It's interesting too, within the Shockwave space. Typical protocol for Shockwave is 5 or 6 treatment sessions. They space them out every 3 to 4 days minimum, or at least do, I would say, a once a week session. Time for the body to do its thing and go through its healing cascade. Interesting, if someone's doing once a week, maybe on that in between, if they stopped in and they're doing the PMF on their own versus waiting the whole week to come back. So there's a lot of really amazing scenarios that our providers could build out, and then also stacking in the red light. What I like about what we're talking about is that implementing PMF creates a situation where you're going to have many touch points with the customer over time, and so we want to look at the full life cycle, and what is that total value, the life value of that client to the practice, and PMF creating that touch point, making sure that we're staying engaged with the client, with the patient, also from a referral based system. Now, here's the outlandish part of it, and I'm sure you see it. I know I see it. I'm out there. But what happens to a practice that doesn't build a recovery system like this into their practice?
Yeah, so what we're seeing here in our discussions, and where we're going to a trade show or people we talk to on the phone, et cetera, is because of the expansion within the recovery space, the health and wellness space, you're really going to get left behind, because if you're not doing it, guarantee someone else is doing it. And there's some, obviously, within the curve and in the swing that we're seeing within this space, there's some people that are way out front, right? And so we want to make sure that we're providing the information to show the impact of how it can help their business model while also delivering to their patients or to their clients. And then again, like you're talking about, that retention rate, right? How do we maintain and keep them in our practice, in our office space, is by providing them the best options that are given them, and whether their family, word of mouth, as you know, for friends and family, hey, go in there, that they got this new equipment, they're going to be able to help you out. You want that kind of noise level around what you're working with, whether it's medical or if it's a gym setting, et cetera. Because speaking about the business model as well, we see that whether it's a medical practice or a chiropractic or whatever, and then whether it's a gym setting, they're creating their own wing, if you will, or area within their facility that's very specified to health and wellness. And so they're putting this type of equipment in there because they can create one, we're going to treat you in the acute setting on the medical side, then we're going to transition you over to the chronic or to the long-term setting for the best result over time. And then you can retain, you can create that membership setting there. And that's how you're going to return that cycle that you're going to want to see.
That's great. So and you brought up a really interesting point in the gym setting. You could set it up with a lounger, put it, over to the side of the gym, maybe have a couple of them. You don't need necessarily medical oversight to implement. You can have it within a gym environment, train, maybe have one of their or multiple other people have that certification. So in the gym, it's more official, and that's it, right? There's nothing additional. So it can be implemented without the medical supervision. Is that true?
Yeah, it's very true. That's a good point. We actually are working with a couple of groups right now that have a gym setting where they're adding in, like, a 2,000 square foot or more wellness center that is an upsell for them for like an elite package, where they're adding on to their membership, where traditionally maybe it's $79 a month. Now they're going to charge $99 or maybe $119, but that gives you access to the wellness center, and you can easily implement a PEMF in that operation.
Yeah, that's awesome. I like that. Now, overall, everything that we've been talking about today, recovery, many times a missing pillar in a lot of these practices. And you'd mentioned they're missing out, not just missing the modality, but people are going to bypass their practice and go someplace else. That's a lost patient. Definitely optimizing recovery. We want to be able to optimize performance, gym environment, help them optimize their performance, optimize their recovery. Now, here's the good part. Most patients aren't coming in to pay for treatments. They want to pay for outcomes, and they want to pay for the overall experience. And
Correct.
let's talk a little bit about that. How much of the when from a clinic perspective, and this is really a sales perspective, because we get into some of these medical environments and the provider staff, they don't really know how to sell a very important treatment. I look at it as a non-negotiable. It's not optional. Here's what we think is going to be your best outcome. But how much of this is then focused on the clinical versus the overall client experience and outcome?
Yeah, it's a great point you make there. We get that question a lot as well. And how do we actually deliver this to our clientele or our patients? And first thing is you have to be confident. You have to understand what you're trying to deliver. And that's where those certifications come in. So I definitely highly recommend that if you're looking to implement this type of equipment or science, that you want to get a level of certification and education around it for you and your staff, so they're confident in front of your clientele and your patients. When you deliver that, that's going to be, again, focus on the results in conjunction with the package, or, if you're using the word package, or if you're using the treatment sessions that we are going to include to deliver that result, you lay it out. And I believe in the same that you mentioned, Jeff, is that it's not a, if you want to do it, it's, this is what we're going to do to get the result. And with that confidence, you're going to provide that to your groups that are going to see over time, to where they're actually going to see it and feel it. And like you mentioned too, if you don't implement as a practice or a business model for wellness and recovery, you're going to have not only one person pass you by, but everyone they talk to. So I like to think in groups of threes. So not only did you lose one, you're losing three patients, because they're going to tell a couple other people.
That's a really solid point. I like that. And we always have to think about patient engagement, patient experience, patient longevity, and who do they see? If they have an amazing outcome, they're telling everybody.
Yep.
If they can't get the amazing outcome, they get it down the street, they're telling everybody about that one. Everyone's following them over there.
Yeah,
Uh,
exactly.
yes, and would it be fair to say that in these types of practices, if you're not creating weekly touch points, there's a high probability chance that you're losing patients?
Very high probability. The more you can touch them, or if they're coming to your facility and you have a wellness wing, as an example, to where they've already achieved their initial goal, but they want to make sure it doesn't become reoccurring. And they want to keep that cellular health. They want to keep that rejuvenation. They want to keep the overall longevity. They're going to come back and pay for that at some level, because again, when that light bulb goes off, just like if you start a workout session, right? You don't believe it until you feel it, but then you see it. And if you can provide that where they feel it, they see it, and they hear it from you and your staff, you're going to have great success.
That's it. Yeah, I love it. One final question, and then we'll get some just last statements from you on this. Put all this together and touching on the business side of it, touching about what should and how should the clinician and the staff talk to the patient. If you were to say, hey, let's simplify this, make it real easy, make it real exciting, how would they present this in terms of the technology to their client, to the layperson that doesn't understand all the medical verbiage?
Yeah, sure. So you got to think about it in simple terms as efficiency. And you want your body, you want your cells, you want your organs to work more efficient. And when you implement PEMF, because it does work at the cellular level, and it helps produce ATP, and you can share that with your groups, that ATP is the powerhouse, right? That's the fuel that runs the cell. The better job you produce ATP, which is going to give your cellular health to be able to absorb and work more efficiently, it's going to help everything internally work more efficiently from a simple standpoint. And that includes recovery, regeneration, circulation, reduction of inflammation. And when you can convey that message with confidence to your patient, whether it's a specific area in the body or if it's total health and over well-being and that aches and pains, you're going to see a benefit within that session.
That's great. I appreciate you sharing that. Any parting words that maybe we didn't cover on PMF?
The biggest thing is a lot of folks that we talk to say they've heard of PMF, but when you ask them, well, what does that mean to you? What do you know about it? Their terminology or their understanding is very thin. And it's one of those, it's like, if you don't know about it, please Google it. Please call us, call Jeff over there to get more information. Because again, once you see and understand what it actually does and how it can be implemented, like we talked about today, how easy it is and what the results can be, you'll definitely want to implement this within your office or practice.
That's awesome. Thank you for that. And here's kind of final words for me. If you're building a modern practice, this really isn't just about adding another modality. It's really about building a system that patients want to have an experience with and the patient wants to stay with because they're getting amazing outcomes. Now, PMF just isn't just some other treatment that you're offering. It's the recovery layer that drives the retention, drives the outcomes, and drives recurring revenue. This is Jeff Rubinoff here, Optimize for Success. And Jeff Swearingen, appreciate you being here with us today. Look forward to seeing you on the next one.
All right. Thank you. Appreciate the time.
Thank you.